Hi, everybody. Welcome to this week's episode of Coping Together. As always, my name is Faith, and I work with the Mental Health Association of Central Florida. I'm actually really excited to talk about this week's episode, or today's episode, because I have Charlotte here again. Charlotte is our Vice President with the Mental Health Association of Central Florida. And today's topic is actually breaking down what is the Mental Health Association of Central Florida. So who are we? What do we do? And ultimately, how has our program developed to adapt to COVID-19 and everything that's happening. So Charlotte, how are you this wonderful Monday?
Thank you so much. I'm doing pretty well. The weekends could be longer, but thankfully we love what we do.
Yes, that's very accurate. Okay, so I guess I'll start. Charlotte's been with this organization for, is it over a decade now, Charlotte?
Yes, in October it will be 12 years. I've had the pleasure of being with this agency, and I started out as an intern, as a lot of our staff does actually, which is a neat opportunity for us to continue to grow within. And that's something that our agency has done. The Mental Health Association of Central Florida has been around since 1946. We have developed and changed as the needs of the community have changed. We actually used to be called the Mental Hygiene Association, which was absolutely a reflection of how health was viewed in the early 1900s. And now it's a bit more reflective of our current state of affairs. We've even continued to adapt for COVID-19.
Okay, so really focusing, it sounds like as mental health has kind of gained more of a awareness and prominence in this country and in this world, the Mental Health Association or the Mental Hygiene Association kind of adapted to that and worked to incorporate that. And I know that it was it 2009 is when the Connections program was developed?
Yes, 2009, the Mental Health Connections program grew from a compilation of flyers and really in tune consumers who had been guiding other consumers. So the Mental Health Association of Central Florida said, we're doing this and we're doing it okay, we can do it better. So we've polished that system. Now, instead of it being a community resource advocate with flyers from community providers, we have an electronic database of over 2,500 providers in the Central Florida community covering Orange, Osceola, Seminole Lake, and Brevard. And we serve over 4,000 individuals and families each year calling in or using our web form, which has been a great adaptation. So on our website, you can click Get Help and complete the form, knowing that a friendly face, be it our staff or our interns, are researching and making sure you get quality resources that meet your unique needs, including travel, insurance, and preference about your providers.
Awesome. So it sounds like, to kind of break it down for our viewers, the Mental Health Association can be broken down into different programs.
Yes, our mission is to provide support, information, resources, and referrals to our community, but we're part of those services. So the Mental Health Connections program is our front door, and it's our connections point to our own programs as well as the community's programs. So if we refer you to community providers or maybe our own clinic, we have an Outlook clinic in collaboration with Orange County government, Walgreens, and Advent Health. We've been able to provide treatment for free to uninsured individuals in Orange County with either depression or anxiety and a comorbid medical condition. Calling our office or going through our online referral is a way to see if someone qualifies. There are further qualifications beyond those broad strokes, but if that checks the box for somebody, they should definitely reach out to us, because in addition to the free treatment, our med managers are so savvy in the system, and with the collaboration for Walgreens and Catalyst Health, we're able to bring prescriptions down to almost $4 a month, which makes treatment achievable.
Wow. So let's say that somebody tries to get into the Outlook clinic, but unfortunately they don't qualify. Maybe they're not an Orange County resident or something like that. That's kind of where you can also bring it back to the Connections program, right?
Absolutely. And the Connections program will consider if you maybe need to see psychiatric services out in the community, and can we find you a sliding scale or someone who works with your insurance? and hopefully partner them maybe with our peer programs. We have a certified peer recovery specialist who's able to guide based on her lived experience and courses she's taken to certify to help an individual move forward on their journey to mental health. Checking in with her is a way to start the conversation if you aren't sure what you want to ask connections for. Maybe you don't know what service you want to explore yet. So working with a peer can help you identify what supports you have in your life and what you need to add into the team to strengthen it. Or she's who you would go to for groups and individual sessions as you've been accessed through the Connections program. So we work very interwovenly in our system, including our advocate programs. We have a guardian advocate program that educates individuals about the Baker Act. In the mental health field, we know there's an emergency service called the Baker Act. And in the community and in our families, we may have heard of this. You call 911 if someone's having a mental health crisis. But beyond those fresh layers or first level layers, the details can be either unnerving, scary, anxiety provoking. We have a weekly 4-hour course that goes through the nuances and educates either peers, family members, or our volunteers who advocate in the hospital for those that don't have an advocate.
And anybody can do that training if they want to?
Anyone can do the training. The internship or volunteer program is restricted to individuals over the age of 18.
Okay, and that kind of leads me to a really great transition with you breaking down the Guardian Advocate program. Our Reflections program, isn't our peer specialist one of the people who actually runs a lot of those groups within the Reflections program?
Yes, it is a direct peer voice with Shawanda Henderson, who is our peer representative, and she is so empowered by her journey and by the impact that wellness has on herself, her loved ones, and her community, that she's driven to dedicate every day of her life to the community's wellness. So it's an open door, whether you're attending her daily depression, anxiety, life stresses, COVID support group at 1:00 every day via Zoom, or if you're calling for one-on-one sessions or the Expressive Arts program, My Story Matters. There are a lot of neat activities that supplement clinical standard wellness. We're meant to be a supportive cog in the system that helps move people forward, whether they're getting connected or are looking to bolster their clinical team.
And just to kind of add to that, we will include the link to our website, as there's all this information about our different groups, things like that can be found on our website, as well as you can give us a call at our office, and any of us would be happy to talk with you. But Charlotte, you actually gave me the perfect segue into my last question for you, which is, with COVID-19, how has the Mental Health Association of Central Florida had to adapt and develop further to accommodate the changes that we've all had to face with COVID-19?
Your question has two answers from me. First is a personal one. Adapting to working remotely or being the one who sneaks into the office to work alone is strange. This is not what the Mental Health Association of Central Florida is used to. We are used to being an open door. We are used to having an overfull parking lot. We are used to saying, well, people are coming in for this and that, and we're ready to receive them, and we're ready to be the happy, smiling face, or at least the comforting, smiling face for somebody on their journey. And we had to halt and reassess, and it has been a personal strain, but we've pulled together pretty well, and I'm really grateful for the team communication that happened as we've adapted our programmings. Now, most of the programs that we offered previously have adapted to a remote format, so we have our trainings and our groups online. One of our wellness programs, due to its fidelity, has a requirement for a face-to-face interaction, and that's still on hold. So that's something we're still working to develop. But otherwise, we've been able to birth new things. We've been able to offer more groups from Shawanda with her remote format. We've been able to partner with local hospitals and are providing a licensed provider to do healthcare workshops for support groups for healthcare workers, hospital staff, first responders, EMS, because of the strain they're going through right now. That wasn't an opportunity we were able to embrace earlier. And then this, Coping Together is such a neat opportunity. This is a neat platform we have had the potential for earlier. We have providers and community connections that make our community and our agency strong over the decades. And this is a chance for us to lift them up, to literally show our community what we have as resources when someone's thinking there's no help out there, and they get to play the episode with Ryan Chu and they see, yeah, there is help out there. And I can actually look at the guy I'm going to call. And Paul from Brave Health, again, another representative who are literally putting their faces out there to say, we're here and we want to help you. So they're looking forward to calls. They're looking forward to connections. And so are we.
I think you definitely touched on what the purpose of this program really is, and it's to keep our community connected with the resources available. And like you said, putting a face to a name changes so much for me. It gives me kind of an emotional sense of who is that person, and it makes that conversation a little bit more real, especially if I am nervous to call and set up an appointment with a therapist or whatever that might be. And I also want to add, in addition to just that development of new programs, we've also shifted to now incorporate, you can text us
Yes.
now,
Great.
which is awesome. So people, a lot of people in my generation really love to text, so they can text us if they want to. We have that anonymity. If you want to do a referral by yourself, you can use our online link like we've had. We're also available by phone, and one of the things that I think we've worked really hard on as a staff is to still have that open, friendly communication, to try to have a face as much as possible in what's going on. So when you call us, we really are people who are there for you. That's what we do every day. That hasn't changed in our intention of working with this association, doing this program. And I'm extremely grateful to work with it, extremely grateful to host Coping Together. And as always, Charlotte, grateful that you were willing to come on and but grateful to come on and answer these questions to kind of break down what our program is. So with that being said, I think we've about wrapped up. Was there anything else you wanted to add?
Thank you so much, Faith. And thank you everyone who tunes in and who shares this. These are episodes that connect people to resources, and maybe as a friendly way that you can say, hey, loved one, this is an option. And we're in this together. So thank you so much. And reach out to us. We're here.
Perfect. Well, thank you guys so much, as always, for tuning in. We will see you on Friday. And as always, if you need us, please reach out to us, whether it's via Facebook, phone, our text line.